we are going to talk about the copper IUCD, that is the copper intrauterine device. There are some things that we are supposed to know. One is that a copper, it is just a device. It is a T-shaped. We all know how the T looks like because a lady has the two fallopian tubes, and also now it protects the sperm, that is the male egg, meeting the female egg to fertilize and make a baby. So we are going to talk about the copper T first, which is the word copper. It is a non-hormonal method that is used by all kind of women, those with babies, those who have not had babies. It can be used by all people. It is a non-hormonal method. This method is inserted by an expert. You can visit your gynecologist. You can visit the healthcare provider in every facility. Everywhere you can access it. It is a very good method. It is a long-acting method indeed. And there are some reasons why some women prefer this method to other methods. One, the method you can use it, it's a private method that when you're inserted, you only go back to see a clinician after 1 year or if you have problems. Then secondly, it is an affordable method that you can be inserted anytime, anywhere in the facility by a qualified staff. It is a long duration method of contraceptive. In fact, when you're inserted an IUCD, you can family plan for 12 years, which is a very good duration, or even up to when you want to plan for the next baby. If you want maybe 5 years, if you want 6 years, it's a very good method. So this method can be inserted anytime. Usually we say when you're not pregnant, because we are saying we are preventing pregnancy using this method. And when you inserted this method, first you should know, we have some tests that we do. One, you may have a HIV test, which is okay. It is good because you need to know the immunity of this client. Secondly, we do a test to screen the cervix. That is, you want to rule out if there are any masses, if there is any cervical cancer or any infections you can get through the cervical examination. That is the vaginal examination. Secondly, when you want this IUCD to be inserted, there's a test we do to check the level of your blood, that is the HB level. Because most of the times when some women get this method, they have heavy bleeding and some get prolonged. So in that case, you want to get to know what is the level of the HB. Secondly, when you're doing the IUCD insertion, you should, we said about ruling out pregnancy, that is, you ask about the menstrual history. You also ask the client if she's, you want to rule out pregnancy indeed. And then you ask if she has a baby who is breastfeeding, if she is on another method that she has been using consistently, and if she's still using the method. So those are some of the things that you can ask the client. So the other thing, we can do a urine test also to rule out any infections as you insert, because it involves a procedure of insertion. So the other thing, of course, you want to know the age of this lady. It can be used by all mothers, as we said, and all women of every age, even those with advanced ages. You know, even a lady who is nearing menopause, she can conceive. We have mothers who are even 49 years old, 47, even 50 who can conceive. And we consider it a good method since it is non-hormonal. We have the non-hormonal, yes, and the hormonal one. Even for the young women who want to plan and they want a method that will not interfere with the hormones, it's a very good hormone. So of course you have to take history of this woman, you have to take the other family history, including if there is any other history that you are interested in while inserting an IUCD. So when you insert this IUCD, there are some things that we expect for a lady. And by the way, every lady is unique. So one can get the pimples on the face, that is the acne. others get heavy menses, some get lower abdominal pains, others get the back pains, others will feel, some even get the discharge, some report increased discharge because of the copper T, and then others, they still get headaches, but because of associated other, maybe associated symptoms. So anything can happen. And by the way, everybody is unique. I must repeat that. So the way I will feel, it's not the way any other person will feel. So we'll talk about insertion. I don't know, many of the women fear insertions of the IUCD. And by the way, the first thing that women say when they come to the clinic is that, oh, I'm going to remove my clothes, I'll be seen or something. Yes, it's okay. For the IUCD, it is usually inserted where we call it the womb, that is the uterus where the baby is, so that we block both the fallopian tubes, not really blocking the egg. You know, we want the egg as it is released from the ovaries, it will not meet the male sperm to fertilize to make a baby. So there are some instruments that are used. Maybe next time when we'll have we'll show you the instruments, because some say that we use big metals, we use big things that make women fear the insertion of this IUCD. So the first thing that we must do is first to talk to the client. We tell the client about the procedure that involves, of course, we'll undress, we'll go through the birth canal so that we access the uterus. So we have some instruments that we'll use. Some there, it's just uncomfortable. Of course, some fear pain. If there's no pain, it's just the discomfort of those instruments that are used, and of course the procedure itself. So before you insert, we said that you have to screen this lady for sexually transmitted infections, for pelvic infections, we call them pelvic inflammatory diseases, that involves any discharge, any pain during the pain in the lower abdomen when we are doing the examination. And also when you're doing that, you should do a cervical cancer screening. Of course, you're going through that route, so why leave that cervix? You should get your cervix checked so that we insert the IUCD. So when you come to the procedure, maybe it's a detailed procedure, but I can talk in lay manner that everybody will understand. So you go through the cervix, that is, we call it the door of the uterus. I know most of the women will get to know this, because when you come to deliver, there's that part that we get to measure, or we get to check if the baby will pass through. We call it the cervix. So of course, when we go through the cervix, we will get into the uterus, then we will measure. When the clients come to me, I tell them, when you want this IUCD fixed, just like you go to the shop and buy a pair of shoes, you must fit so that you don't get an oversized shoe or an undersized shoe, or even a dress that you admire. You know, you can't buy something that is oversized or undersized. So even for the cervix, we have to measure. We call it the sounding. Most of the health workers know about this, where you get to know the length of the uterus. So an average uterus, or maybe the clients who is eligible, those clients who are eligible for the insertion, they measure we measure them in centimeters, from 6 centimeters to 9 centimeters. So those above 10, if we get mothers who are above 10, the risk of the IUCD expelling, or it might not help you as much. And then those who are below 6 centimeters, it's a short measurement, so the discomfort, and then we don't want to risk about injuring the uterus, and also of course the chances of expelling. So we must measure that uterus. So that's why most of you feel like, hey, what is going on? There's so much activity going on. So when this client is measured and this client is eligible, I carried the IUCD, it's here. It's usually packed. When you come to the clinic, it is usually packed. And every time you're inserted, you are always shown the seal. As you can see, it is enclosed and there are some things inside there. So every client, we said, is unique. So when we do the measurement, we said 6 up to 9 centimeters. On this paper, you can see some measurements. It starts from 0. That is the upper part of the uterus. That's where we sound. It's called the fundus. So from there, from the 0, you can see some measurements. Maybe I can push harder so that you see. It's up to there. I hope everyone can see. And then you'll see some white, like a tube, which is there. And then there's a blue thing there. We call it the planche. So when we get the measurement, we will come and measure. Let's say, for example, my client is Jackie. She measures 6 centimeters. So by the time we measure, we said the seal is, you see, it's closed. So we remove it. You can remove it. Allow me to remove it so that we also see all of us. We open like this. Yeah. And it is a sterile thing, meaning it is a very clean procedure where we don't want to introduce any infections to this lady, because we said that some of the infections that we check are like the pelvic inflammatory diseases. So we don't want to introduce any infections. So as you can see, there are 3 things. There's this paper. There's the first one that has where my thumb will get in. And then now there's the tube that holds the IUCD itself and also has the planche. As you can see, I think I want to remove so that all of us can see, and then we'll do maybe just a practical insertion. We say the copper T is a T-shaped device, or just it's a method, a contraceptive. It is called a copper T because you can see both the ears are coated with copper T. And also the long part here, you can see it, it's also coated with copper. So when you have unprotected sexual intercourse, or it's because you're using it as a family planning method. So the sperm comes here. The sperm will it meets a hostile environment. So that conception takes place, the environment must be good. But because we are using a copper T for contraceptive purpose, that is against pregnancy, so when it comes, it will just find this area is just unconducive. It's hostile for the sperm. So for the ovaries, we said both the lady has 2 ovaries, the left and the right. That's why it's coated, so that most conception takes place, fertilization takes place at the center part of the fallopian tube. So even if this sperm passed and the ovary, this place is just coated with copper, so conception will not take place. So the other thing is about the strings. As you can see, they are nylon, and when we insert them, they are quite long, so we cut them. So most of the partners will say that when we have intercourse with my spouse or my wife, I feel the strings. Yes, you will feel them the first few days, and then after that, because that area, the way God created us, it is warm and moist, so these strings will eventually become soft, so they will not feel. So don't worry, you who has felt the strings, and you can even always come back and be checked. So don't worry about them. So, and also before I leave on that point, these strings are not meant to be touched. You find that when a lady is inserted the IUCD, she keeps on inserting her fingers to check if the IUCD is in place. I tell us ladies that that area, keep it. Our fingers and our hands are they carry the most, the most number of germs. So when you go inserting those fingers, you find that you're introducing infections to that area. And of course, even the string, you can even feel the string. Some tend to like shake and feel like it's in place. This IUCD does not interfere with their maybe sexual life, if I would say so, because this is an unhormonal method, and it does not interfere with any hormones of this lady. It does not interfere with her hormones that will make her any mood changes or anything. So it keeps her the woman, the natural woman she is. So remember, I told you about the insertion. We reached at that point where we were saying about inserting, you have to measure. And now there are some few things. When I show clients, or even when you go to your gynae, you see such things and you wonder, oh, this will fit in my body. Yes, these are just the gadgets to help us insert the IUCD. Remember, when a lady has given birth, that area, the one that we call the cervix or the door of the uterus, it also gets closed. It goes back to where it was before that lady gives birth. So at some point it will close. With our own bare hands, we cannot get inside the uterus. So that's why we have some small gadgets here we use to insert this IUCD. So I also have a model here, you can see. This one is it's just to demonstrate of how us the ladies look like. And of course, most of us, the ladies, of course, you've been visited, maybe those who have come to give birth. Of course, um, when you want this IUCD inserted, we have three areas that we are interested in. The opening, that is the external part of this lady. We want to know if there is any abnormalities or anything that can make us not get inside. And now we go to the birth canal, and of course now the cervix and the uterus. So some women may have fibroids, so it is hard for us to insert. Others, of course, we said you must know if you're pregnant or not. And of course, those other issues that we talked about. So this thing is just to aid us and show us how when the IUCD is inserted, how it looks like. So of course, this is just a dummy. And when you come to our facility, even if you're just curious, there are those open days that you'll get in the health facilities. You can also go and learn some of this information. So let's say, for example, we are inserting a lady. Let me call her Natalie. This lady, Natalie, wants to use the IUCD. So we measured the length of her uterus, and we found that she's 6, let's say even 7 centimeters. And this IUCD comes when it's packed. It's packed like this. The strings are inserted there usually. And it comes when it's like this, a T-shaped. So remember we said the cervix is closed. So, and then this instrument or this IUCD is packed. It's packed like this, and it has this. So the healthcare provider, so that it gets inside, the ears, I call them the ears, they get inside, they should be closed, where we hook this IUCD, and eventually it is something like this. Like you see, initially the ears were open like this, remember? So it cannot get inside when it's like this. So you have to you make sure that the ears are closed. We do it inside the seal, and like now I'm doing it outside here, so that we keep this procedure sterile. You do like, okay, for the healthcare workers, I know we all know about this. And now it should be like this, something like this. And of course, your provider will show you what she or he is inserting. So, and now you come here. We said we have 3 places. Now the paper is where you are going to measure your 7 centimeters. Of course, your doctor or your nurse will walk with you throughout the step. Yes, up to there. Up to there. If I come out with this, sorry. Up to there, it's 7. If you see this paper and the IUCD, they must correspond. Remember, we said we don't want an oversized shoe or undersize. Of course, it's not a shoe, but then you want to give it the best measurement so that this lady will not conceive. It's a contraceptive. We are preventing pregnancy. So when this lady comes, of course,